Thank you so much. I want to start by thanking Senator Warnock for inviting me to speak this morning and for leading the charge on this important issue in the Senate. Additionally, thank you to the Majority Whip Clyburn, Senators Ossoff, Baldwin, and Warren for being champions of this very important cause. One of my top priorities in Congress has been ensuring that Americans of all backgrounds have access to quality, affordable health care. This is why I introduced the Medicaid Saves Lives Act in the House, and why I am so pleased that this legislation has been included in the House side in our economic plan. In Georgia's 7th District, across the state and around the entire country, too many people are unable to access the medical care they need due to the Medicaid coverage gap. Despite significant financial incentives provided by the Affordable Care Act and the American Rescue Plan, Georgia and the 11 other non-expansion states have still refused to act. Expanding Medicaid has the potential to provide health care coverage for 4 million Americans, and that includes 646,000 Georgians. We must change the notion that the state you live in affects your access to affordable health care. The choice in Georgia not to expand Medicaid has a very real human cost. I am always reminded of a man in my district who showed up at an outpatient clinic in excruciating pain. He was in so much pain that he could not even hold a pen. He was a day laborer at a warehouse, which means that he had a low income, and of course, in Georgia, this meant that he didn't have health insurance because Georgia did not expand Medicaid. He came in desperation to the doctors, who had to tell him that we are so sorry. You have advanced stage rheumatoid arthritis. If you had come to see us a few years ago, even a few months ago, we could have given you anti-inflammatory drugs that would have protected your joints, and you would still be working today. But now the disease has destroyed your joints, and there is nothing we can do but to give you painkillers to relieve your suffering. This was a man who only wanted to work, and they said it was sad. He went from station to station in the clinic asking if there was any work that he could pick up. And they saw him, and they was like, well, no, I'm sorry about that. The irony of this story is that now he's eligible for disability, and now he's eligible for Medicaid. As you may know, my background is in budgeting and public finance. This is fiscally irresponsible because it's a lot more expensive to pay for disability than it would have been to pay for the anti-inflammatory drugs up front. It's fiscally irresponsible because each and every one of us in Georgia who has health insurance pays for the uncompensated care and our rising health insurance premiums. But fundamentally, it is morally wrong that we hang our working people out to dry in this way. And I have story after story like this. Women showing up with tumors that you can see through their breasts because they waited until late-stage breast cancer to show up to see a doctor. Men having strokes because they can't afford the doctor's visit to get the hypertension medication that they need. Parents of grown children with mental illness who cycle through our prisons because that is the only place in Georgia that they can get health care. The decade-long failure to expand Medicaid in Georgia has cost us dearly in lives and, of course, in expense. Over the past decade, I have written op-eds, memos, protested, posted on social media, and in no small part, I ran for Congress because of my frustration with Georgia's failure to expand Medicaid and the devastating consequences it has had on people's lives. Since being elected, I have worked with my friends in the Senate and a coalition in the House to provide financial incentives to persuade Georgia and other non-expansion states to expand, all to no avail. I am done with arguing, begging, and protesting. It is time to finish the job of ensuring that everyone has affordable, quality health care. It is time to close the coverage gap in Georgia. It is time to expand Medicaid. Thank you again to my colleagues for having me this morning, and I will now turn it over to my good friend, Senator Reverend Warnock, to take questions.